Hi, I'm Dr. Jim Hatfield, Encinitas Podiatry Group. Today we're going to talk about bunions. Usually when people come into the office complaining of bunions, what they think is that they have a growth or a bump at the base of the big toe. Actually, what this represents is a shift in the bony architecture within the foot. As you see in this illustration here, these are the toe bones, these are the long metatarsal bones, and you can see this first metatarsal, which should be over here, parallel to the other metatarsal bones, is shifted away from the second, and as it has, the big toe is shifted back. And what that creates is a relative bump, but it's not a growth on the bone, it's just a shift of the normal bony architecture. So when we evaluate a bunion deformity, we have to do a number of things both clinically and with the x-rays. Clinically, we evaluate the joint. We take it through its range of motion to determine if there's any arthritis or pain within the joint. We want to look for the flexibility of the foot at its very joints. We watch people walk, and then we take an x-ray of the foot, and this is what we would see in a person with a bunion. Now, when we evaluate this, again, we measure the angle between the first and second metatarsals. Normal angle is 8 degrees. This person has a 16-degree angle. We also measure the angle between the first metatarsal and the big toe. Normal is 12 degrees. This person had a 30-degree angle, so she was well into bunion territory. Now, what's involved with correcting a bunion deformity? Well, this is done in the surgery center on an outpatient basis. It's done under local anesthesia with sedation, so it's a very safe type of anesthesia. Now, after anesthesia is achieved, what we do is we make an incision over the bump, and we go down and we remove a little bit of the bone right here, but we can't stop there. We have to correct these angular relationships, otherwise it's just going to come back. So what we do is we make a cut in the bone here, and we take this section and we shift it towards the second toe to close down the angle here. We hold it in place with a couple screws so that it stays in place and the correction stays. We then reef up on the big toe to get it straight, and this is how the same foot would look after bunion surgery. As you can see, the angles are corrected very nicely, both the first, second metatarsal and the big toe. You can see the two screws that are holding the bone in place. Now, what's the post-operative course? This person is able to walk the day of surgery. What does that mean? It doesn't mean you're going to the mall. It means you're staying around the house and keeping your foot up for the most part. But you're able to get around the house and do pretty much what needs to be done around the house. Patients can go back to work at 1 or 2 weeks post-op, depending on what type of work that they do. There's usually not too much pain during the post-operative period. We see the people on a weekly basis, change the dressings. We take an x-ray after the first week to make sure the bones are where they're supposed to be. Stitches come out at the end of 2 weeks and keep you wrapped up pretty well until the end of 3 weeks. At that point, you can get back into an athletic shoe. This is how a typical patient would look both before and after surgery. Now, what can we expect as far as the long-term results? Here we have a patient who had surgery back in 1981, so we've been doing these for a while. This is my longest follow-up on a bunion case. This person came back to see me on the right foot at 12 years post-op. As you can see, the big toe and the first metatarsal are still lined up very nicely with the second metatarsal and the second toe. She came back at 16 years post-op on the left foot, and you can see that foot's lined up very nicely too. So we've got quite a few of these under our belt. This is a very rewarding procedure for both the doctor and the patient. If you have a bunion, come on in, let's take a look at it, see what we can do.